Hi everyone, welcome back to my channel. In today's video, we are going to discuss important questions from ICD 10cm. This is very important for your CPC exam preparation. Let's start with the first question. What does MRSA stand for? Option A, methicillin resistant Staphylococcus aureus. Option B, methicillin resistant Streptococcus aureus. Option C, moderate resistance susceptible aureus. Option D, mild resistance Streptococcus aureus. The right answer for this question is option A, methicillin resistant Staphylococcus aureus. MRSA infection is caused by a strain of staph bacteria that becomes resistant to the antibiotics commonly used to treat ordinary staph infections. Next question. When a patient has a blood test for HIV that is inconclusive, what ICD 10cm code is assigned? Option A, Z21, option B, R75, option C, B20, option D, Z11.4. Can you think of the right answer? The right answer is option B, R75. You can find the answer in your ICD 10cm manual, Chapter 1, Chapter Specific Coding Guidelines. Patients with inconclusive HIV serology may be assigned code R75, that is, inconclusive laboratory evidence of human immunodeficiency virus. Without thinking much, we can decide the answer is R75. Next question. A 23-year-old patient presents to the emergency department with a cut on his leg. He is a confirmed AIDS patient as documented in the record. What ICD 10cm codes should be reported? In the options A, B, C and D, the first code is S81.819A. The code S81.819 is for laceration without foreign body, unspecified lower leg. In the question they have mentioned 23-year-old patient presents to the emergency department with the cut on his leg. So they have not mentioned which leg. Therefore, laceration without foreign body, unspecified lower leg is the right code. The meaning of laceration is tear or cut in the skin or flesh. Okay. The seventh character A is for initial encounter. Therefore, the first code is correct. Now we have to decide between the second code, that is B20, Z11.4, R75 or Z71.7. In the question they have given he is a confirmed AIDS patient as documented in the record. It means that the patient is having HIV disease. And as per ICD 10cm guidelines, if a patient with HIV disease is admitted for an unrelated condition, for example, traumatic injury, the code for the unrelated condition is the principal diagnosis. Therefore, we have to code S81.819, that is the code for laceration. We have to code it first. And in this case, AIDS is reported as the secondary diagnosis. When you look in the alphabetic index for AIDS, it refers to B20. Therefore, if a patient with HIV disease is admitted for unrelated condition, first we have to code the unrelated condition and next we have to code B20. Therefore, the right answer for this question is option A, S81.819A followed by B20. Option B will be wrong because the code Z11.4 is for encounter for screening for HIV. In the question, they have not given encounter for screening, and the code R75, that is for inconclusive HIV serology, that is wrong. And option D is also wrong because Z71.7 is for HIV counseling. Next question. What does the fourth character in diabetes mellitus diabetes codes indicate? Option A, the condition as controlled or uncontrolled. Option B, any complication associated with diabetes. Option C, type of diabetes, type 1, type 2, secondary. Option D, if the diabetes is primary or secondary diabetes. The right answer for this question is option B, any complication associated with diabetes. The fourth character in diabetes mellitus codes indicate the complication associated with diabetes. For example, Subcategory code E10.2 indicates a person has kidney complications due to diabetes. Therefore, the fourth character indicates any complication associated with diabetes. Next question. A 70-year-old patient with COPD. The full form of COPD is chronic obstructive pulmonary disease. A 70-year-old patient with COPD is admitted to the hospital for acute exacerbation of bronchial asthma. What diagnosis code is reported? Let us directly check the codes in the tabular list. J44.1 is for chronic obstructive pulmonary disease with acute exacerbation. J44.9 is for COPD, that is chronic obstructive pulmonary disease unspecified. J44.0 is for COPD with acute lower respiratory infection. J47.9 is for bronchiectasis uncomplicated. In the question, they have mentioned acute exacerbation of bronchial asthma. The right answer will be option A, J44.1. In the ICD-10-CM alphabetic index, you can look for asthma, asthmatic bronchial with chronic obstructive pulmonary disease with exacerbation acute. It refers you to the code J44.1. Next question. A patient is being treated for ketoacidosis and diabetic coma due to malignant neoplasm of the pancreatic body. The patient uses insulin routinely. What ICD-10-CM codes are reported? So here they have mentioned the patient is treated for ketoacidosis and diabetic coma due to malignant neoplasm of the pancreatic body. It means that the patient's diabetes is due to pancreatic cancer as the underlying condition. You can use simple tricks to eliminate the wrong options. In the question, they have mentioned patient uses insulin routinely. We have to use the code Z79.4, that is long-term current use of insulin. Therefore, we'll eliminate the options which do not have the code Z79.4, that is option A and option D. Now we are left with option B and option C. In option B, the code is E10.11. E10.11 is for type 1 diabetes mellitus with ketoacidosis with coma. And in option C, they have given E08.11. The code E08.11 is for diabetes mellitus due to underlying condition with ketoacidosis with coma. According to the question, the diabetes mellitus is due to underlying condition, that is due to malignant neoplasm of the pancreatic body. Therefore, the right code will be E08.11. We can eliminate option B because in the question they have not mentioned type 1 diabetes. They have mentioned diabetes is due to underlying condition. Therefore, the right answer will be option C. The code C25.1 is for malignant neoplasm of body of pancreas. That is correct. Next question. A 58-year-old patient sees the provider for confusion and loss of memory. The provider diagnoses the patient with early onset stages of Alzheimer's disease with dementia. What ICD-10-CM codes are reported? In this question, the diagnosis is early onset stages of Alzheimer's disease with dementia. Let us check the first code in option A, that is G30.0. G30.0 is for Alzheimer's disease with early onset. Okay, therefore G30.0 is the right code. When we verify the G30.0 code in the tabular list, there is an instructional note under the code section G30 which confirms that we should code also for dementia. F02.80 is the correct code because the provider does not mention any behavioral disturbances. Therefore, dementia without behavioral disturbance F02.80 is the correct code. First, we have to code G30.0 followed by F02.80. Right. Therefore, we can eliminate option B and D which mentions F02.80 as the first code. The right answer for this question will be Option C, G30.0 followed by F02.80. The code in option A, F29, is wrong because it is for unspecified psychosis, not due to substance or known psychological condition. In the question, they have not mentioned anything as such. And the code R41.3 is also wrong because it is for other amnesia. In the question, they have not given amnesia. Therefore, option C will be the right answer. That's it for today. Thanks for watching. Don't forget to hit the like button, share and subscribe to my channel. Good luck on your CPC exam, everyone. Trust your preparation and you can do your best.